Good morning once again, dear colleagues. Thank you to Dr. Mshai Mwangola from Kenya for enabling us to have this collaboration. And we thank our colleague, Dr. Justice Mavizenge, for joining us. And the judge, Key, is unable to join us, and hopefully we'll have him in the future. To everyone who has joined us, it is a privilege to have you. Nobody, not even the best of scenario strategists, predicted that today, on the 2nd of June, we would be in the middle of this kind of disruption. I'm not aware of any scenario strategist that predicted a COVID-19 disruption. And as somebody who trains on leadership and on managing in a VUCA environment, I've always said that VUCA is not only linked to the 4IR, that is an environment that is volatile, uncertain, complex, and ambivalent. It has always been there. What happened was that the 4IR, or the fourth industrial revolution, made VUCA VUCA on steroids. I'm just wondering, now that we've had COVID-19, if VUCA was disruption on steroids, what then is the kind of disruption we've experienced under COVID-19? We are here to scrutinize the responses of African governments to the coronavirus, COVID-19, in terms of the policies they've taken, particularly focusing on the impact of those policies on the rule of law and on social justice. But we do so being acutely mindful of the fact that African leaders were already confronted with difficulties, and that this novel virus presents a novel situation that not much had prepared them for. But we still have to scrutinize them because it is part of accountability. And today we will scrutinize them on the basis of the rule of law and social justice. And you might want to ask, what are we going to use to make that determination? Just firstly, what is the formula? The formula I prefer is the formula I used as a pub protector, which is what has happened. What should have happened is that a discrepancy between the way African governments have responded to coronavirus, COVID-19, and the way they should have done so in terms of international law at UN level, African continent, and SADC, in terms of their constitutions, and in terms of the existing laws, and in terms of just common sense, justice, rationality, and reasonableness. Is there a gap between what they did and what they should have done? If there is a gap, is it an explainable gap? Is it a reasonable gap? Can we rationalize the gap? But to the extent that the gap cannot be rationalized, and to the extent that the gap has a negative impact on the rule of law and social justice, how do we fix it? But before our panelists give us a sense of how they understand the gap, I would like us to firstly talk about what is the rule of law and what is social justice. The best description of the rule of law is one that became popular after I used it for the first time as public protector. And I must be honest that I found it in Curacao being used by the public protector of Bermuda. And this is what Mandela said about the rule of law. Even the most benevolent of governments are made up of people with all the propensities for human failings. The rule of law, as we understand it, consists in the set of conventions and arrangements that ensure that it is not left to the whims of individuals, rulers, to decide on what is good for the populace. And I would like to read that again. The rule of law, as we understand it, consists in a set of conventions and arrangements that ensure that it is not left to the whims of individual rulers to decide on what is good for the populace. The administrative conduct of government and authorities are subject to the scrutiny of independent organs. This is an essential element of good governance that we have sought to have built into our new constitutional order. And then he gives us examples of the structures that we put in place. Of course, in the South African context, it's the courts, the public protector, and etc., being the instruments that they put in place to make sure that, firstly, government did not operate according to the whims of individuals, but secondly, there was accountability for actions. The way I understand the rule of law, therefore, is where there's no rule of law, you have rule by decree, and where there's rule of law, you have governance by consent. And has COVID-19 created an ambivalent environment where the rule of law, as Mandela understood it, cannot obtain? Or has the executive overreached? Or has there been scope creep? Or has there been scope creep by the executive in our continent? Those are some of the things that our panelists are going to talk to. And the instruments we are going to use are international conventions, the rule of law as we understand it, and our understanding of social justice. I've given you the rule of law as I understand it based on what Mandela said. The other instrument that is worth looking at in our understanding of the rule of law is the World Justice Forum, that tells you what should be the environment that allows the rule of law to prevail. That environment where there's governance by consent, nobody's above the law, and government never does anything that it's not authorized by a law to do. There are 4 factors or pillars of the rule of law as understood by the World Justice Forum. One is accountability, including participatory democracy. The second one is just laws, and those laws are based on human rights, and they include equal treatment and equal protection of the law. And you must understand that just laws are laws where people have participated in the making of those laws, and therefore they don't discover they've violated the law when they've already violated the law, and they don't discover that their rights have been violated when those rights have already been violated. The third one is open government. Opacity is anathema to the rule of law. And the last one is accessible justice. In a rule of law environment, when rights have been infringed, people have to have access to a forum, or a court or a forum that can adjudicate on those rights. Social justice, as we understand it in the social justice chair, is an environment where the humanity of everyone is embraced, where there's equal enjoyment of all rights and freedoms, not just some rights, not an environment where the poor are only said to be entitled to a basic level of socioeconomic rights. It is an environment where everyone is entitled to every human right, social, economic, cultural, developmental, etc. And that environment is where there is a fair and just distribution of all opportunities, resources, privileges, benefits, and burdens. And that could be in a group, that could be in a society, and that could be between societies. I'm going to ask my colleagues, Justice and Mshai, we can call each other by first names to make things easy for everyone. I'm going to ask you, dear colleague, perhaps let's start with you, Justice, to just give us an overview of your understanding of the extent to which the way our governments have responded to coronavirus is in line or not in line with the rule of law and the dictates of social justice. But please start with what they've done well and where are the gaps and the instruments that you are using in terms of the gaps. And I do know that in a previous panel organized by IDM, you specifically referred us to international law and where you thought there might be gaps. And I'm going to leave it to you to do so. You have 8 minutes to do so, Sam. Thank you.
So first, I would like to say thank you to you for inviting me to appear on this panel. And thanks to colleagues on the panel, and thanks to your viewers and the listeners from across the region and across the globe who are following this debate. I like how you have started, Prof, by providing some kind of an understanding of what the rule of law and access to justice is. I would like to, maybe in responding to your question, try and start from where you ended, and say, perhaps from a human rights point of view, which is an area that I'm much more comfortable with, at the core of access to justice and the rule of law is the principle that, I mean, just to make it easy for everyone to follow, is the principle that every human being or every person is entitled to certain human rights, which must be respected, protected, and fulfilled at all times. And whenever those rights and other legal interests are threatened or violated, the person has the right to access an independent and impartial tribunal for appropriate relief. Now, we can have a debate about what are those rights and what do those rights mean. But as we have that debate, we must understand that there is already a consensus which exists on what are those rights, what do they entitle us to, and in the event of a crisis such as COVID-19, what is it that is permissible and what is it that is not permissible? So there is consensus at national level, at regional level, at a global level. And allow me, Prof, to just run through some of the key instruments that I think we need to reflect on as we have this debate in this forum and beyond. So globally, of course, you have mentioned some of the instruments, but I think the parent is the Universal Declaration of Human Rights itself. Then we have the International Covenant on Civil and Political Rights. We have the International Covenant on Economic, Social, and Cultural Rights. But I think we should also remember that we have some instruments at a global level which deal with rights pertaining or guaranteed for specific groups of persons who are in most cases considered to be vulnerable. So we have the Convention on the Rights of the Child, which deals with the rights of children. We have the Convention on the Elimination of All Forms of Discrimination against Women. We have the Convention on the Rights of Persons with Disabilities. At the regional level, we have the African Charter on Human and People's Rights. We have the African Charter on Rights and Welfare of the Child. We have the Maputo Protocol on the Rights of Women in Africa. These are some of the key instruments which reflect the consensus that we have at a regional and at a global level on what these rights are, what is permissible for government to do during times such as the COVID era, and what is not permissible. Then, of course, constitutionally, at a national level, we have constitutions across Africa. Each jurisdiction has a constitution which codifies that consensus. We have a Bill of Rights, I think, in almost all these constitutions across the region. And the Bill of Rights underpins this principle that I talked about, the principle that every person, regardless of their standing in society, is entitled to certain rights. And when those rights are violated or are threatened, the person must have access to an independent and an impartial tribunal for redress. That tribunal can be a court of law. That tribunal can be, can be a civil or criminal court of law, can be an indigenous justice tribunal, can be any other tribunal. Now, Prof, you have asked me specifically to talk about what governments have done properly to start with. I think our governments should be congratulated for, first and foremost, acknowledging that we are facing a crisis, and for putting in place measures which I think have gone a long way in terms of saving lives. I think the level of carnage that was expected to be witnessed in Africa as a result of COVID-19, we can say at this point we have not witnessed that level of carnage or that level of loss of human life. There are arguments, of course, that maybe the systems of documentation are weak to the extent that what is officially declared is not what in reality is happening on the ground. But I think we can acknowledge that there are flaws in the documentation, in the process of documentation. But I think if we were experiencing loss of life at the level that had been predicted, we would have been noticing it, and we would have been feeling it as Africans. Because when a person dies in our communities, we all know. We may not have the specific numbers, but we all know. We would all know that there is death. So I would like to believe that our governments have done very well in terms of preventing the loss of life in the way that we had been told or we had anticipated, and that's a good thing. However, I think there are red flags, Prof. There are red flags which I think are emerging, and these red flags can be understood because, like you mentioned at the beginning of the discussion, that this is an unprecedented crisis. So mistakes are bound to happen. There is bound to be opportunists, both in government and outside of government, who would like to take advantage of the situation to achieve their own personal interest at the expense of the interests of the collective. Red flags for me are in about 5 areas, and then I will pause so that we can then hear from the other panelists, and I can come back later to expand on some of these things. In my view, I think there has been suspension of what are supposed to be non-derogable rights. The obvious rights that have been suspended, which in terms of international law, in terms of regional law, in terms of national constitutions across the region, cannot be suspended, are freedom from torture and freedom from inhuman treatment. But I would like to talk about this other right, Prof, the right to life. So the right to life cannot be taken away even when we are facing a crisis, even as we are trying to respond to a crisis. Of course, we have seen the obvious violations on the right to life, which include, use of excessive force by our security personnel as they were enforcing the COVID-19 regulations. And we have not just seen this in South Africa, we've seen it in other countries as well, Zimbabwe, Mozambique, Angola. But there is another violation of the right to life, or another suspension of the right to life, which I think from a social justice point of view needs to be debated and need to be discussed thoroughly. It's this idea that people can be locked up or locked down can be locked up or can be locked down in their homes for a period of time without being given social support in the form of livelihood, such as food. I think we know, and statistics show us that in SADC region alone, there is about 4 million people who live from hand to mouth. And these people, if you lock them up in their homes, that is, if they have homes, and you don't give them any assistance in terms of food aid, those people are going to die. So because they are not food secure. So in my view, whilst governments have done very well to introduce these lockdown measures to prevent the spread of COVID-19, they may have, in a way, suspended the right to life for some vulnerable persons within our society, particularly those who are unable to, who live from hand to mouth. So further research, I think, needs to be done to establish how many people died of hunger during the COVID-19 lockdown periods across the region. The second red flag, Prof, is the suspension of rights without following due process. Due process in terms of seeking parliamentary oversight, and due process in terms of engaging the regional and international mechanisms. You would know, Prof, in terms of Article 4, as we now know from the Saracusa principles, and as we now know from jurisprudence, that whenever a state derogates from some of these rights or any of these rights, they are supposed to notify the United Nations through the Secretary General. But also one would have expected that for some of these countries who have declared states of emergency, they were supposed to notify also the African Commission. Because although the African Charter does not make provision for derogation from rights, but when you suspend rights, you are actually violating rights. You are violating rights, and you in an extraordinary way. And one would argue that the government is supposed to notify the African Commission for purposes of accountability. There is the third red flag, Prof, is unfair discrimination. As we try to relax the lockdown measures to get back to life, open up society, we see that there is over-reliance on digital means to provide public service. Within the realm that I work in on a daily basis, which is access to courts and access to justice, I mean, governments are talking of digital courts as a way of promoting access to courts. But we are forgetting that we have a huge part of our population across the region who have no access to these digital means, and may therefore not be able to access the courts that we are establishing, and may not be able to access the other social services and basic services which they are entitled to as a matter of right. And this includes access to education and so forth. The fourth red flag is the something that relates to transparency and accountability. I like that you touched on transparency and accountability, Prof. And let me develop that point by mentioning that transparency and accountability are the pillars upon which the rule of law rests. It is impossible to have rule of law in an environment where decisions are taken in secrecy in an environment where decision makers are not answerable are not answerable for the decisions that they make. Now, what we have seen is that because COVID-19 is a crisis, governments in certain jurisdictions have, in a way, taken that as justification to then avoid transparency and accountability. And what that has created in the short term is what other people has characterized as COVID-19 corruption. Let me just give you anecdotes that I think are a tip of the iceberg. In South Africa, I think at the beginning of the lockdown, there were reports or allegations that about 22 million rand had been misused in procuring blankets by the social development department in KZN. And the allegations that prices were inflated. Of course, the good thing is that the Premier of KZN has committed to conducting a thorough investigation into those allegations. But that situation has arisen as a direct result of lack of transparency and accountability. Now, in Zimbabwe, we are talking of corruption. There have been reports of corruption to the tune of 980,000 US dollars when government procured some COVID-19 utensils and materials at inflated prices. And again, government has said they would investigate these allegations. I don't believe that these are the only reports of corruption in Zimbabwe and South Africa or across the region. I believe that there are numerous incidences of COVID-19 corruption as a direct result of transparency and lack of transparency and accountability. I would end there for now, Prof, and allow the other panels to come in, and hopefully I can come back later and either respond to specific questions or develop further some of these issues that I've raised as red flags.
Thank you, Doc. I am not going to summarize except to just point out that one of the areas that the doc has applauded is the speed or agility with which African governments responded and understood that we had a crisis, and he believes that in so doing they did avert the carnage that we could have experienced. And he has given us 4 red flags. Let's contemplate those before we go to my friend and my colleague, Mshai. But I would like you guys to reflect on whether the made in China approach was both a gift and a curse in terms of responses to COVID-19, given the different levels of development and levels of integration into the digital world of communities in Africa, and levels of food security and economic security in our continent. Miss Dr. Mshai Mangola, can we have your views, ma'am? You do also start with indicating what you think governments have done right in terms of aligning with the rule of law and the dictates of social justice. Over to you, ma'am.
Thank you very much. And I also just want to start by expressing my appreciation, because on a personal note, this has been a great opportunity for me to just sit and reflect. And I think sometimes when there's so much happening, we don't really stop to take the time out to reflect. So I'm really grateful on a personal note for that, and for then, of course, this amazing conversation that allows us to think beyond our own borders, because I think sometimes it's very easy to just get caught into what is happening in your own country. And I also really appreciate your invitation to start by thinking, what have governments in Africa done well? Right at the beginning of the crisis, I remember being struck by something that I believe it was the Prime Minister of Singapore had said, in which he made the point that one of the, I don't think he used the word gift, but I'm going to say that one of the gifts of this opportunity is going to be that we have the opportunity to test our systems. That there are many systems that we have put in place, there are many conventions, and I really appreciate the justice for going through so many the conventions that our countries have signed. We, for the most part, have got pretty solidly good constitutions. I know, Professor Tuli, you were with us when we met in Naivasha just before this whole season started. And the Stellenbosch team will remember that one of the things that we discussed with the team from the World Policy Analysis Center was how well and how progressive African constitutions actually are. When you compare them with the rest of the world, some of the most progressive constitutions in the entire world are found right here in Africa. And so for me, this has been an opportunity to ask, okay, we've done the thinking, we've done the theory, we've signed the conventions, we have some of the most progressive constitutions. Some countries have fantastic laws, but what does it actually look like? And policies too, when it comes to the test. I would like to look at this whole question from the point of view of the citizens, from the point of view of what does it look like in real terms to people living on the ground. And so I want to just, everything I'll be talking about, I'm a performance scholar, so I'm constantly asking, what does it mean when you translate this into lived experience? And I think it is fair that we begin by saying, and I think both of you have made the point, that Africa and African governments have done remarkably well when you compare it with what people's expectations were. I remember, I think it was Melinda Gates who got roundly criticized all over Africa because her biggest prediction was that we would be seeing bodies in the streets of Africa. And everybody was talking about how, okay, things may be bad in these other spaces, but wait until it gets to Africa. And you almost got a sense that the world, even where people were really struggling, as we watched it go through Asia, through Europe, into the Americas, some governments were almost had this sense that, okay, we aren't doing too badly. When it gets to Africa, you'll see how badly it is. And so I think we need to start by saying, it is not that Africa can say we've completely dodged the bullet. We cannot say that we have done things perfectly. People have died, and we will be talking about some of the things that went wrong. But we must start by recognizing that the first thing I think African governments did very well was that they took seriously, for the most part, not every country, and we can talk about that later, but for the most part, African governments took very seriously the threat that this pandemic posed. I think partly this is because we do know that disease happens. In many of especially in the West, I think people have forgotten what it is like to have a disease come through your systems. And you know, I've been talking especially to, there's a project I'm running on the city of Nairobi. And one of the things we've been doing is spending a lot of time in thinking through our history. And I have been struck that even when we look at Nairobi a century ago, the idea of plague, at times it was bubonic plague, the question of epidemics coming through has always been part of our experience, especially our urban experience, and knowing what to do and getting ready for that crisis. And of course, in Asia and in Africa, we've been experiencing, we know about Ebola, we know about SARS, we know about MERS. So we did not make the mistake of assuming we would be able to handle it. And I think the steps that informed the approach, where governments were very quick to take some very quick steps. In preparation for this, I actually went and looked through some of the policies that countries took right across Africa. And I'm happy to go through them, to mention some examples later on if you want. But in general, I found that it was the same policies. It was almost like they were reading from the same. And of course, the question that you have asked, Prof, in terms of was it right? People have critiqued the fact that so many of these policies seemed to have been taken from the West or from Asia, and asking, were all of them right for Africa? I think that's another question. But in general, we find that almost all countries began restricting travel very, very quickly. In some cases, they were restricting from first China, then Asia, and then from the European countries, that especially France and Italy. But countries were very quick to start to talk about travel restrictions. Many countries extended those travel bans locally, so that you find in many cases where, for instance, the big urban centers, especially capital cities, tourism centers, commercial capitals, were the first ones where they had restrictions of movement from those places to the rest of the country. Looking at it from what it looked like to people, one of the things that we were, has been very interesting to me, is to trace the way that parts of people who are affluent, and in Kenya, there's this, people who go abroad, people who travel, that seemed to become stigmatized almost immediately. People were caught sneaking back into the country, because when people knew you had traveled, people would look at you with, another look of, hey, what's going on? Are you sure that you are safe? I remember a BBC documentary that for me was very interesting, and they were interviewing somebody who works in houses. She goes in and she assists those households by helping in their cleaning and their cooking. And this is a lady who works in different houses. So her job is that she moves from household to household to household. And it was following her as she left. She lives in a place called Kawangware. And Kawangware is near some of the, how many of our African cities are set up where you have a fairly, middle class or affluent neighborhood, and next to it is a neighborhood which people who come from a less affluent circumstances, and these are often the people who are service providers to the domestic households of the more affluent households. And so it follows her from leaving her home, and she's reflecting with her neighbors of the danger she's putting herself going into these affluent areas on a daily basis. Talking about, the people whose houses I go to, they're the ones who are bringing us the disease. Another way that this also translated is in Kenya, when people die, even if you live in your urban centers, many people still want to be buried in their ancestral homelands. And we began to get reports that when people traveled for funerals, even after the government restricted numbers, in some cases, people were being told, if you've come from Nairobi or you've come from Mombasa, you stay over there. Even though we may be in the same funeral together, park your cars separately from us and stay away from us. And we can come back to talk about, I'll come back and talk about this in terms of the social consequences of that. The other thing that we began to see a lot of is closure of borders. And in some cases, this happened very quickly. In some cases, people closed certain borders, but kept other borders open. And I think one of the lessons that this taught us is how connected we are in Africa. For some countries, closing your border is an impossibility. I think it is President Museveni who said, had this really interesting image of East Africa. And he said, some countries are like the living room. Some countries are like the bedroom. You cannot shut the door. You cannot shut the door to your kitchen because you need to go. But we saw the closing of borders. We also saw the closing of several spaces, such as religious. Very quickly, religious spaces. And remember, we have just gone through Ramadan. So that was a really big thing for Muslims. Churches were closed, entertainment spots were closed. And I know for artists, that meant that their income immediately went down. But governments were very quick to realize that these are places, restaurants, shopping places, these are places that could increase the spread of the virus. Governments also, as I said, have done lockdowns. Governments also began to impose curfews. And the curfews, the idea of the curfews was that you are trying to restrict movement in times when, by keeping people at home, perhaps you also are lowering the likelihood of some of these things to the virus to get infected. We have seen masks coming in, and one of the things I found very interesting is how quickly Africa moved to making cloth masks, and how quickly people realized that we don't have to buy the imported masks, which we cannot get, but you have masks that are being made. And then the other things that government that we have seen is a whole range of innovations. From on the medical side, of course, everybody knows about COVID organics coming from Madagascar, but also a whole range of going back to the kind of things that people can do that are medically proven, not to cure the disease, but to raise immunity. We've seen apps, for instance, to do with testing being developed right within the country. And then we've seen quarantines as people came and traveled. Governments have created centers where people can go. And now I'm talking very generally, that these are some of the good things that we have seen. I want to also highlight that certain governments, not all governments, but certain governments have done some amazing things. Rent has been, in some countries, governments have told landlords to be more lenient in terms of people being late with rents. We've seen governments talk to banks. You know, for instance, in Kenya, they have said they've tried to make it easier to do mobile payments by suspending certain payments. We've seen some governments giving financial relief or food relief to vulnerable communities. We've seen governments giving masks and extending some PPE, not only to hospitals, but to other essential services people. We've seen some governments have paid for people who are in quarantine and have actually paid for people who are undergoing treatment. We've seen, I think it is, I think it was Nigeria I saw, that have paid electricity and paid water bills for the entire country or for certain areas in the country. And we have, and so there's been really a range of things that governments have taken. There's a but to all of it, and I know I've run out of my 8 minutes, but each of the things that I have said have come with costs. And I'm just going to run through some of the costs that that we have seen as a result of that. For instance, and I think I'll go back to some of the things that my brother has said. The biggest one, I think, is very, very quickly, we began to see how the restrictions on movement have had very, very big consequences for people's livelihoods. And people who, if I am unable to go out and work because my restaurant has been closed, if I am an informal trader and I'm unable now to go into the streets and sell things, if I am unable to go to the markets, there is a social cost to that, that giving people food aid does not immediately address. We have seen the abuse of security services. And in Kenya, I checked as of this morning, we have 10 people who have died because they have been beaten up by police. The latest one only died last night. And this is somebody who is a homeless person who was found outside. He doesn't have a home. So the police found him on the streets. They beat him up so badly last night that he died as of this morning. We have 10 documented cases. And of course, as we said, other people have died. One of the people who died actually died because he took a mother to hospital. He was a cyclist, a boda boda as we call him. He took this woman to hospital because she was about to deliver a baby. On his way back, the police stopped him and he was killed. Now, that story, as it spread, meant that many more people were afraid of leaving their homes, even in terms of an emergency at night. So we do not know, as my brother said, how many other people have died as a result of this. We know that the other big case that comes to mind was somebody, now again, I'm talking about the restrictions of travel, which have had, I guess, a good reason. But the other day we woke up to news that this man whose wife died in Mombasa travels to the center of the city, of the country. He's coming with his family to bury his wife, and they're stopped after going through several police checks. At the very police check, last one, as they're entering his home county or his home state, the police stop him. They tell him that they should not be traveling to come and do a burial. They force his family to go back to Mombasa, and this poor man is taken with his wife's body and has to spend the night with a body in a coffin by himself outside a police station. The trauma of that kind of thing is completely unconscionable. And I think we can go down, and I'm sure we'll continue to discuss this, the many different ways that these very, very good ideas that the governments have had have not taken into account the effect on ordinary people, what it means when you do some of these closures, when you set up very hard and rigid policies that do not see the humanity of the people that we are dealing with. And finally, I just want to end with this thought. Prof, you began by saying that there are not many scenarios that have predicted pandemics. I've seen a couple that have predicted pandemics. One of them, last year, we did a scenario process on energy futures for East Africa. And we looked at this question of what would happen if an epidemic comes through. How would we think? How would we respond? And I want to end by something that Dr. Godwin Murunga has been really emphasizing based on an article that Professor Suleiman Bashir Diagne, who's Senegalese, has written on prospective thinking. And one of the things that Professor Bashir has emphasized is that when we develop a prospective attitude to our policies, when we develop a prospective attitude to thinking through our laws, and you've talked about the rule of law, what it enables us to do is not to act and react in a reactive mode when crises come, because crises will come. Pandemics will come, epidemics will come, all sorts of natural disasters will come. But it means that we get ahead and we think through the implications of some of the things that we are doing. And what Dr. Murunga was sharing with us this week in our seminar was he was taking us through how Nairobi as a city, when it comes to dealing with health, when it comes to dealing with epidemics and even the pandemic a century ago, was in a crisis mode. And so we reacted and we set up some of these restrictions that have affected us or affected the people of that time in very negative ways. And I fear that for many of the African governments, we've fallen into that trap again. We are back to reactive modes as opposed to a prospective attitude. Thank you.
Thank you, Mshai. Thank you, Dr. Mshai. Thank you, Dr. Justice. Let's give them a virtual round of applause for such wonderful, wonderful insights. Just a few questions in the next 8 minutes before I allow the people to engage with you. The first question I asked was about the made in China or made elsewhere, whether there was sufficient scrutiny given to these solutions and meshed with the circumstances. At the Social Justice Chair, we say that governments should use data analytics to predict the likely impact of any policy they're about to take on all members of society or all groups in society. And Dr. Justice, you mentioned, for example, that we were quick to say everything should go digital. One example I have is a match between, one of your complaints is the right to life being not just the absence of illness, but the right to life or the absence of illness or death caused by illness or death caused by directly being killed by the state or somebody else. But the right to life being also exposure to amenities and opportunities for enhancing your quality of life. And you mentioned that by restricting movement of goods and persons, some people didn't end up with food. So it was inevitable, though, that if you lock people down, there would be no food. But if data analytics had been used, if you look at a country like South Africa, we do have a poverty map. If the planners took the poverty map and looked at the vulnerabilities, hotspots for vulnerability, and decided, okay, we're going to impose a lockdown. I mean, we had more than 10 days of thinking about the lockdown, because I remember it was announced that we're going to have it just before I came back from a cruise. So there was more than 10 days. During that 10 days, the poverty maps could have been taken and looked at who's likely to be vulnerable. Employment statistics could have been taken to look at those who are self-employed, who are likely to be totally without income, the ones who are living from hand to mouth. So I could excuse government and say, it's very difficult to think laterally in the midst of catastrophe. And Dr. Mshai, you're saying we shouldn't think transactionally, we shouldn't think reactively. But in the midst of a crisis, it's possible to think like that. But now we're almost 3 months down the line. 3 months down the line, we have a community called Emanzimeleni in South Africa, where we were approached, as we get approached as the Tuma Foundation, by communities that are saying food has not arrived at our place. We got one of our ambassadors, or a couple of our ambassadors, to take names of people, data, and send it to government and say, check these people, they claim they haven't received food, can you check if they've received food and assist them? And guess what? Government says, no, we can't assist you. Every one of them must approach us as an individual. And we said, not everyone has access to a smartphone. They said, no, they don't have to have a smartphone, they must have a phone. But statistics from Statistics South Africa show that only about 30% of our people engage in using the cell phones beyond just answering a call from the other side. So that's not a good match. I don't know about the rest of Africa, but I'm saying governing for impact, and also the rule of law is about governance by consent. Governance by consent being we govern together and then we comply by consent. So I want to ask you, dear colleagues, and say, from just the point of view of just laws, do you think that perhaps there could have been more, after a couple of weeks, there could have been more understanding of the local environment and making sure that either we change the laws or the regulations or we have better compensation strategies? The second question is about open government. Dr. Justice, you said on open government, the ICCPR is very clear when a state of emergency should be imposed and how should it be imposed and what rights are non-derogable. I would like you, okay, Mshai, if you could answer the first one, and Justice, if you answer the second question around what do we do now? What has gone wrong there? And what would you recommend governments do to adapt to the reality on the ground? Right, Dr. Mshai, first.
Thank you, and I'm glad that you brought up this question. The made in China or made wherever we are importing some of our responses to. I think, Prof, I would like to start by just making the point that, and I agree with you that I said we can begin to we can. There's a level in which we can expect that some of these things will happen, in the sense that we need to have our disaster preparedness always at the back of our minds. It needs to be a priority to say that disasters will come. They will come to every country, no matter how well organized that country is. Disasters are a fact of life. And so any government must have part of its mind beginning to anticipate what are the kinds of disasters that might come. In the last month, with the Elephant, which is an intellectual community that I interact with, I've helped found it, and I continue to be very much engaged in. We have been putting online a series of conversations with African intellectuals. One of the things I have been completely blown away is by the depth of the thinking, the level of expertise that we have, either sitting right here in the continent or out there in the diaspora somewhere. We came across, and for me, this was completely fascinating, because this is somebody I knew when I was in college 30 years ago. And somehow, we meet up on Facebook, it turns out that she got her doctorate in disaster management. Her name is Dr. Njoki Mwarumba, and she's living in the US. She's sitting in the US. But this is what she does. She teaches it, she studies it, and she began talking us through what are the levels of disaster management. What is it that you need to have put in place? How do you prepare your systems so that when something happens, you have a plan? Now, you will not know that coronavirus is the one that's going to erupt. You do not know what form the disease will take, but you have a team whose job it is every morning to turn up and to think through some of these things and to start to put plans so that, as you say, when the crisis comes, the turnaround time is not long, right? And I said that the government did very well. They acted very quickly. They took some good steps, and we need to commend them for that. But I think we haven't really invested in the intellectual resources that is sitting right here in the continent. And apart from looking at what are the actions we need to take, these are also the group of people. It needs to be a pretty multidisciplinary team so that you have people who are disaster management specialists, and I've discovered that's an actual field. But you also have people from different areas who are able to inform that thinking. So for example, we talked to Dr. Richard Aya, he's a medical doctor, but also has his doctorate in public health. And he was talking to us about how public health infrastructure right across the continent, people used to, generally you're falling into clinical medicine when you think health, or you're thinking about the public health side of it. I'm thinking of the other term that is coming to mind, but going. And so how many of our countries have let our public health infrastructure kind of fall into disrepair. It's not had proper investment. People haven't put the resources in place. But when this pandemic came, one of the discoveries we made is that what has been most effective for Africa has not been the clinical side, which is that's the way China had to go, because by the time they woke up to it, the people were dying, people were in hospital, they needed the hospital. The same thing with Europe. Where Africa has gotten ahead is to go by the public health side of it. So the whole thing of the lockdowns, the whole thing of wearing masks, the whole thing of sanitizing, thinking through some of those things is a public health response. And that then has taken us back to the question of social justice. Because now, and I know in Kenya, those have been some of our big debates, it is one thing to tell people you must wash your hands, you must sanitize constantly, you must have hand sanitizer at home. It's another thing for people to be able to do it. If I am living in an informal settlement where we do not have access to running water, how do I then wash my hands? Even if I know how to wash my hands, I know the 2-minute thing and so on. If I don't have access to clean running water, I may not be able to fulfill that. If I do not have access, if I share my sanitation facilities with 20 other people, and then you tell us we must keep distance from each other, not just a physical distance. In this case, it is a social distance. You tell people stay at home. It's not going to work. So you also have another set of people who must come in and think through, how does the question of physical distancing work in societies where social distance, where the society is how we survive, right? When somebody gets sick, we do not, for most countries, have a healthcare system where your medical needs will be taken care of. You rely on your neighbors, you rely on your friends, you rely on your community to be the ones who take you to hospital, to be the ones who pay the bills. So the government must think through, what does this term social distancing mean in that kind of a circumstance? And I think the first thing that the government needed to do was to tap into our intellectual resources. I remember I was talking to the director of IDS, and he said, if we can do that, he said, for the first time, governments are talking to us again. And that's a great thing.
Wonderful. Well, thank you, Dr. Mshai. If I may summarize that, it was good to borrow, and it's a good idea to borrow. But once having borrowed, don't copy and paste. Borrow, review, and use internal intellectual capital to adjust and adapt to circumstances. Is one of the things that you have mentioned is the fact that some of these rules are totally blind to social life. And partly is the characterization of life as commerce and health. And there's nothing in between. And therefore, there doesn't seem to be sufficient understanding that it's life, commerce, and social life. And a lot of the infringements of social life have come from, possibly from being blind to those things. And you've mentioned the issue of funerals. I think in South Africa, there's been a similar concerns around funerals. I was laughing at one of my friends yesterday. It's not funny though, but we laughed together. Her mom is sick and she's going for an op today. In terms of the law, she is allowed to go and bury her. But in terms of the law, she can't get a permit across provinces to go and see her before she goes to hospital. There's no way she can ask for a permit because the regulations did not foresee that kind of thing. And part of the concern that has been raised is emphasis on rule as opposed to governance. We rule and will rely on the police to get you to comply, as opposed there's a governance situation where we rely on you to collaborate because we're in the same boat and it's in all our interests to make this thing work. Dr. Justice, can you answer the rule of law question and say?
Thank you very much, Prof. And thanks to Mishai. I think that's a profound response to the question that you were dealing with, and it set me up to give my response to this rather very difficult question that Prof has assigned to me. It's a difficult question because a lot of time, it's a difficult question, but a necessary one. And I'm glad to deal with it because a lot of times we are actually accused of just being critical of what governments are doing, and rarely do we propose solutions. So that those are the allegations that we face. Let me just make sure that I'm quick in my response, but I preface my response with some key statistics, which I think reveal what I call here Africa's pre-existing conditions before COVID-19. And obviously, these are not stats from the whole of Africa. They're just anecdotes, but they show you, they give you pointers on certain things. So in SADC, we are talking, according to the SADC 2019 synthesis report on state of food and nutrition, we're talking of 41.2 million people who are living, who are food insecure. So sorry, earlier on I said 4 million. It's actually 41.2 million people who are food insecure. In Zimbabwe, because of lack of employment opportunities in what is commonly regarded as the formal economy, we are talking of now 4 million informal traders. In other words, people who are living on informal trade as a form of employment, as a form of as a way of generating of generating livelihoods. And in Harare alone, we're talking of 800,000 vendors, Harare and Chitungwiza. So these are people who trade at market stores, dotted across the two cities, 800,000. In South Africa, I think it's both the World Poverty Clock and to some extent corroborated by Oxfam. We're talking of 10 million people living in poverty, in abject poverty, without access to basic commodities. And we're talking of 5.4 million living in informal settlements without, again, basic access to basic sanitation and all these other basic necessities of life. And we're talking of 200,000 people are homeless, according to the Human Sciences Research Council. Those are anecdotes which I think reveal our pre-existing conditions. Now, I think what then we needed and what we need going forward in order to strengthen, or in order to ensure that we have this open governance principle taking shape in our response, what we need and what we need, what we needed and what we need. And I think this is also what Mishaya was talking about, is a pan-African, pro-African approach to responding to our disaster. And there are two types of responses. So there are responses which impose restrictions on fundamental rights, which we are used to, or which are guaranteed to us as human beings. It is necessary, I think, going forward, that African governments need to ensure that they comply with the two critical principles of necessity and proportionality. So these restrictions must only be imposed if they are necessary. So for each restriction, I urge every government official to ask the question, is it necessary? Is it really necessary? Then the second question is, are we not using a sledgehammer to crack a nut? Are we not causing more damage on the right than what is actually necessary and what is actually needed? So that's the principle of proportionality. So that's what they need to comply with insofar as every other restriction that they are putting in place is concerned. And now that we have flattened the curve in most of our jurisdictions, we have time to review these restrictions and test them as to whether they comply with the two principles. Now, lastly, responses are not just about restricting human rights. Responses to disaster are also about taking certain positive actions to actually address the disaster by way of enabling people, our people, to access certain facilities or to access certain necessities. There are three things that I think are very key. And some of them, they underscore what Mishai spoke about. I think we need stronger regional coordination. Dealing with the virus in South Africa alone is not going to be adequate, because South Africa does not live in a vacuum. South Africa lives as a member of a regional community of nations, as a member of a continental community of nations. So we need to be looking at how all the governments are doing. We need to ensure that there is solidarity between nations, between peoples, to ensure that as we are dealing with the virus in South Africa, in Zimbabwe, in Tanzania, in Kenya, we are also dealing with it in the rest of other countries. So that when we open up the borders, we are all able to then prevent, we don't backslide in terms of the rate of infection. So the second one is to ensure that we have lockdown with social support. Of course, I have talked about 41.2 million people are food insecure. If you read that report, and if you read, and part of my research when I was doing my PhD, also revealed to me that people are not necessarily lacking access to basic amenities such as food because there is no food. No, it's because there is unequal access to food. There is unequal access to the available resources. So if we actually want to provide social support to the people who are vulnerable, we can be able to do that by marshalling resources that are locked up in exclusive pockets and make those resources accessible. And by also leveraging on solidarity amongst our our countries. Then lastly, Prof, is the deepening transparency and accountability. I've talked about how, and you have also talked about how transparency and accountability can actually be implemented. But I want to point out this thing that I think at a very philosophical level is very important. And Mishai has touched on it. It is important for our governments to realize that, to have confidence in their own people, that their own people can actually be responsible about their lives if they are given enough information and if governments take them into their confidence about what they are doing. You can't obtain public trust without being transparent and accountable. I think I will end on that note.
Thank you. Thank you, Doc. Basically, what we're hearing from the two colleagues is that the response has been great. However, there are areas where there could be improvement. One mentioned by Dr. Mshai is the importance of readiness for disaster. Incidentally, Dr. Mshai, you are correct. Part of the definition of good governance, based on the UN definition of good governance and the World Bank's definition, includes the ability to manage disaster management readiness. And South Africa has been commended as one of those that are competent to do so because we have a law. But Dr. Mshai, you mentioned something about the coronavirus having given us an opportunity to test our systems. Because it's one thing to have a law, it's another to implement that law. I don't know if there are other countries in the continent that have disaster management law. South Africa has that. And Dr. Justice, you've mentioned, you've underscored the importance of a continental response. And I do remember being at a meeting at the Tolbeck Foundation where it was mentioned that pandemics and clouds don't know any borders. And you're right that there's been predictions of pandemics, except that nobody knew it was going to come so soon and test our systems so fast and basically leapfrog everyone into the fourth industrial revolution, where we find ourselves on e-governments, e-learning, and everything basically on the net and commerce. We're supposed to get questions from the public at this stage. Let me just check if there are any questions from the public. I don't see questions. Marna?
Prof, yes, there's no questions, hasn't been questions, there's been quite a few comments. Would you like me to read some of the comments?
Okay, if you may do so, and then dear colleagues, just listen to those comments. If those comments require a response, I will ask you to respond directly to save time.
Okay, so one of the comments at the top was from Linley. Just an interesting research question proposed here about the right to life, that we need to find out how many people have died from hunger due to COVID. How will we get this data, and is mortality data readily available, and how we can go about it? So I don't know if that is something that you or one of the panelists want to respond to. I think it's more a general, almost like a rhetorical question that Linley placed, but I think a very valid question. Then also another one, Dr. Mishai, wonderful reflections. Indeed, Africa has begun to looking inward finally to resolve its problem. The key question is, how will we sustain this innovativeness? So maybe that is something, Dr. Mishai, that you can think on. An example, it was Lindley again here, was will we have think tanks, funding sources, organizations so that would-be innovators can apply for funding? Will we establish venture capitalists so the William Kamkwambas, the boy who harnessed the wind, Elon Musk's, the SpaceX, Tesla, and many more like the Louis Pasteur Institute, Dhaka, and others can stay on the continent. So in other words, what type of funding prospects do we also have? So I think maybe if you would like to address those two questions first.
Thank you, Marna. Does anybody want to answer the question about data? We do know that South Africa does have the capacity for data on many areas of life. It might be a question around disaggregation, but we do have data. We are fortunate in that regard. I'm not sure about Kenya, and Dr. Justice and Dr. Let's say, Dr. Mshai, do you know anything about Kenya's capacity and capacity from the other places? Regarding innovation, will you also answer that question? Where, Dr. Mshai, you did suggest that we should have a continental response and that we should also use available intellectual capital in the continent. And you applauded African governments for igniting innovation and supporting innovation in areas such as the masks, the ventilators, etc. And the question is, how can this be sustained at a continental level? For example, we heard that Sierra Leone had invented a test that could allow you to know your status, your COVID-19 status immediately. If that's true, how do we make that accessible to everyone? How do we invest in that? We know that the Africa Institute for Mathematical Sciences, AIMS, is working with Rwanda to find a better way of testing, and they've started piloting in Rwanda. They would like to pilot in South Africa. How do we have that supported at continental level? Let's start with you, Dr. Mshai.
Thank you very much, and those are great comments and push us forward in our thinking. A quick answer in terms of disaster management. Yes, we do have such an institution here in Kenya. I think, however, for us and for me, one of the issues that have emerged around that is that because of our experience in the last, say, couple of decades, a lot of our thinking around disaster management has been in connection with terrorism. We have, unfortunately, been the victim of terrorist attacks. And so a lot of the response when we think about disaster is where a bomb goes off somewhere. What that has meant is that our disaster management responses tend to have been securitized.
Mishai, maybe whilst she's getting her connection back, Dr. Justice, you can maybe proceed with your answer, and then we can catch up with Mishai again.
Sure.
Thanks.
That's fine. I think the question that was, I think, that I would be happy to respond to is the one about, how do we do research to establish, to find data which unravel or show the extent of mortality as a result of things such as hunger and so forth. I think it's important to highlight, I think, the work that is being done by a lot of our civil society network groups across the continent. A few come to my mind, include such as the Southern Africa Human Rights Defenders Network, the International Commission of Jurists as well, which is where I work, the Media Institute for Southern Africa. These are organizations that have been doing monitoring and most likely have some relevant data which can respond to this question. But I also think that if we touch base with our traditional structures, such as I know in other countries, including South Africa, traditional chiefs, the head persons, they have knowledge and they have information about what is going on in their communities. Independent commissions are also very important. I've seen some wonderful work being done by human rights commissions across jurisdictions as they have been monitoring the situation. But also, as Prof. Madonsela has mentioned, government agencies, especially those that are mandated to collect stats, like Statistics South Africa, can be very useful or can have some data which is useful. But the only thing that I would underscore is I think a lot of discussions have focused on the number of people who have died as a direct result of the COVID-19, the pathogen or the virus. But there has not been much conversation about, mortality as a result of hunger, as a result of poverty arising from responses to COVID-19, the pathogen. And I think there is need for that discussion to continue. And I think this platform has touched on that as part of the social justice question. And it's important to actually, I think, continue with that conversation and that conversation is necessary because it will enable us as the continent to recalibrate our responses and ensure that we continue to ensure social justice even as we respond to this crisis. Thank you.
Wonderful. Before Dr. Mshai, before you get back to the mic, I would like both of you to then give some closing observations, just in terms of how you see the congruence between the rule of law dictates, the social justice dictates, and the manner in which African governments have responded to the coronavirus, COVID-19. In so doing, you can touch on international law. We have looked at the Article 4 was mentioned of the PIR. We also mentioned the African Charter, and we also mentioned the Maputo Protocol, but I would just want you to look at your closing observations around that congruence between what has happened and what should have happened. In assessing that congruence, also look at your understanding of what was the requirement in terms of social justice and compliance with national constitutions and laws. And I would love you to end with your clear suggestions on what should be done going forward. We are going to submit your suggestions to the African Union, and then between Mshai and us, we will also make recommendations that will go to our respective governments. I'm going to start with Dr. Mshai. Just you answer the question that was asked previously and make your concluding observations. I've borrowed a little bit extra time, and therefore you have about 5 minutes to do that.
What I was saying was, I think if we have the 21st century Pan-Africanism and we start to think about how we can work across borders, I think we start to help each other. First of all, I think and I want to just say 5 levels very quickly. I came in and I heard Dr. Justice talking about civil society. I think that's very critical, that we find which organizations are already working across borders. What are the solutions? How are they going about it? So that instead of us trying to replicate these things in our different countries, we're actually working across. I think it's also very important with social justice issues that we begin to look at similarities and we begin to raise our voice collectively, so that if something is going wrong in one country, in the other countries, other people are also raising their voices, because that is how you put pressure collectively on governments. I think the area of philanthropy is very important. And again, there are there's a growing number of African philanthropic organizations. And while it is great that we are turning to IMF and to other external bodies, because we are a part of the world, and so that is our right, I think this is truly a time to begin to think about and to grow the response of philanthropy organizations within our continent. One of the very heartwarming things in Kenya that has happened is to see how locally people have begun to collect and to organize and to give. And sometimes the small giving then grows into a big stream, but also to really begin to think about how as a continent we can put in the big picture philanthropic organizations, because the money and the resources are right within this country, this continent. I also like the idea. Now, I think there's been a lot of talk of how governments can collaborate, and we talked about that. I think it's really important to create structures where the judicial system, so a lot of the times you talk about the executive and how the executive can come together and can work together. But I think it's really important for us to think about the big picture. Courts, the African Court of Justice, the regional courts of justice, but also all these, I know judges get together, I know lawyers get together. How do we think through these questions of access to justice as the judiciary, and then also as the legislators? In many countries, and I know at least one country where parliament was shut down, especially countries where there's been a state of emergency, I think it's really important that people's representatives in the forms of parliaments during a time like this begin to think through how our responses will be going forward. And most importantly, and I want to say this as a way of ending and as a way of thanking the Social Justice Center for hosting this webinar, is that I think intellectually, we must begin as African intellectuals to begin to connect, first of all, across our spheres, those working in research institutes, those working in artistic and cultural spaces as intellectuals, and then those working in the academy. And then turning to regional bodies, or continental bodies. Somebody I saw talked about in Dakar, the Louis Pasteur Institute, but also what's happening in Senegal that I think is very interesting is that they have a regular program where all the academy gets together and thinks through the intellectual side to this. I know of organizations like CODESRIA, which is the Council of the Development of Social Science Research in Africa, which brings together all these social scientists and people in the humanities. And then a place like the Social Justice Center is now stepping up. And I think that's so important to have these conversations right across the continent. And I really do want to thank you for those kind of collaborations, because I think that is our future when it comes to guarding and furthering social justice and the rule of law in Africa. Thank you very much.
Thank you, Shai. Can we have your parting shot, Dr. Justice?
Thank you very much, Prof. Again, from me, I thank you, and I thank the Social Justice Chair for creating this platform, which has allowed a necessary conversation to take place across Africa. This allows us to create synergies. This allows us to leverage on each other's strengths, and this promotes solidarity. Something that was said by the Secretary General of the United Nations and was also echoed by the chairperson of the African Union Commission, that we must ensure that when we come out of this crisis, we should be better than we were when we entered into this crisis. And the second point was, we cannot achieve that if we do not, number one, take a human rights-centered approach to our responses. Human rights in the sense that you are putting people's needs to be at the center of your response, and third and secondly, ensuring solidarity. And I think my sister, Dr. Mishai, has provided the nuts and bolts about what that solidarity looks like. I think my parting shot is really a message to our governments that, above all, I think it is important to always mainstream the needs of the most vulnerable persons in our society in our responses, to ask the question, how would this kind of a response impact on the needs and circumstances of some of the most vulnerable persons in our society? Vulnerable, not necessarily because of COVID-19, but they were vulnerable already before COVID-19. They have peculiar disadvantages which require special attention. And when we begin to ask those questions, and I think now we have the opportunity to ask those questions because we have, to some extent, flattened the curve. When we ask those questions, then we will be able to respond as a continent to this disaster. Thank you very much, Prof. And thank you, fellow panelists.
Thank you, Dr. Justice, and thank you, Dr. Mshai. Thank you to everyone who has participated by way of questions, comments, and suggestions. And thank you to the social justice team that has helped to put this together, Diane Gahiza and Marna Lawrence. Thank you for being part of this and for making this possible. We have gathered together to review the policy decisions of governments in the African continent. The purpose of our conversation today was to assess the level of congruence between the policies that have been adopted in response to COVID-19 and the dictates of the rule of law and social justice. The two colleagues, and some of the people who have made comments, have applauded African governments for the swiftness with which the governments responded to the problem before it became a crisis. The compassion with which there was a consideration in terms of extending health services to everyone, almost creating national health services, universal national health services across the continent. However, the colleagues have commented about some of the disparities or discrepancies between what should have happened and what happened. We've heard about the concern around the fact that some of the governments seem to have declared de facto states of emergencies without complying with the dictates of international law in this regard, particularly the CPIR. We've also heard that in our response to the right to life, we have emphasized the spreading of the virus, but without considering the impact of not having food on the right to life. And African governments are being warned to look at those factors. There's also been concerns just generally about the dictates of democratic governance and the non-derogability of many of the human rights that seem to be derogated under these states of emergencies. In terms of solutions, the main solution suggested by our two panelists and some of the commentators is that it's okay to borrow from other countries, but these solutions need to be then domesticated. And one of our colleagues, Dr. Justice, suggests that in the domesticating process, we should make sure that we pitch our policy responses to the level of the most vulnerable in society. And Dr. Mshai says in doing so, let's leverage the intellectual capital in the continent. Let's leverage the innovative capacity in the continent. And let's operate as one family and as one ecosystem. And within the continent, we have enough resources and enough solutions to take care of this virus. But lastly, our panelists have said that this is not the only pandemic we're going to face in our lifetime or disruption. It's going to be important that our governments are always ready for a problem of this nature. And as a result, it's important to have some continental approach to this. Thank you again to everyone who participated. We are going to put together a report, and we hope that this is the beginning of a continental approach to the rule of law and social justice, focusing in the near future on how we respond appropriately to the coronavirus, COVID-19. Thank you. Blessings.